Welcome to Talent Talk with SSM Health. My name is Becky Feldman, and today I'm joined by Maggie Fowler, System VP and CNO, and Jeannie Monahan, Executive Director, Nursing Practice and Clinical Effectiveness. Today we'll be talking about why being a nurse at SSM Health is different, and what it truly means to be a nurse at SSM Health. Let's start by hearing how these nurses got started at SSM Health and how they got to where they are today.
I'm Jeannie Monahan, and I've been with SSM Health for over 30 years. I started as a new graduate on the night shift at Cardinal Glennon Children's Hospital, and was fortunate to be able to work in a variety of roles in that hospital, including advanced clinician as a nurse practitioner, as a direct care nurse, in leadership roles, and in education roles.
And I'm Maggie Fowler. I've been part of SSM Health for 25 years. I started my career as Director of Spinal Cord Injury at SSM Rehab, housed at St. Mary's. And since that time, I've served in 9 different roles across the organization, primarily St. Louis, but for the last several years have been supporting nursing across SSM Health on our 4-state operations.
Both of you have an incredible list of job titles held during your career here. Can you speak to the development opportunities that are available to our nursing staff?
I think one of the advantages at SSM Health are we have so many different care areas. We have hospitals across 4 states that have different specialties for nurses and different levels of care. We have academic hospitals, we have community hospitals, so there is something for everyone. We have a great nursing leadership team that works with nurses individually. They're excellent at identifying high performers and being able to guide them in different opportunities that the organization has. So you can stay with the organization for over 30 years and continually grow and find new things to do.
I think the other thing to add is that we have formal education programs, as well as we support continuing education, continuing formal education for our staff, tuition reimbursement for those who are pursuing advanced degrees, and I'm glad to say that I am a benefactor of one of those. I completed my MBA through tuition reimbursement when I was with SSM.
And Jeannie, you also have used tuition reimbursement several times.
I have. It's like guided my whole education career for a master's degree in nursing and as a certificate for a neonatal nurse practitioner. And currently, SSM is supporting me to get my doctorate in nursing practice.
So we know there's no shortage of opportunities for nurses these days. And the development opportunities that we offer here are great. But there is so much more that draws a nurse to SSM Health and keeps them here. Why is being a nurse at SSM Health different?
I think one of the important things to know is that there are opportunities everywhere, but it boils down to what is important to you as an individual clinician, what's important to you as a person. SSM is very mission and values based, and by that I mean that our founding sisters, the Franciscan Sisters of Mary, they put the heritage of SSM in our hands as an organization, and that is something that we hold very true to our hearts. Every year on our voice survey that we've done to date, our mission and values is our #1 strength as an organization. Our employees tell us that all the time, and because of that, that's something that is important for you to know, because to be part of this organization has to be something that fits for you.
I think one of the other neat things about being part of such a large integrated health delivery system in 4 states is that each one of our hospitals really truly has a unique culture. And it might be hard for you to kind of understand what the difference is between those. So as a nurse, you can go out to ssmhealthcareers.com/nursing. You can hear from each one of our CNOs and also learn a little bit more about each facility. Another key differentiator we have at SSM Health is our professional practice model. Maggie, can you share with us how this came together? And this visual really helps pull it together as well.
It was about 4 years ago the chief nursing officers at and all of our entities across the system came together to identify what was our role going to be, what is nursing's role in helping SSM Health achieve its 2020 strategic direction. One of the things that we came away from that conversation was not only a strategic plan, but a core element of that was going to be a consistent platform for nursing practice across the organization. And so the work officially began in the fall of 2014. With a visioning session with the chief nursing officers. Through 2015, we engaged the nursing practice councils across the organization to ask them, what does it mean to be an SSM Health nurse? And from this, we created the visual that's in front of you. You'll be able to see that we are mission and values based. It needs to be part of who we are because it's a core element of SSM. Sacred trust. Nurses are the #1 trusted profession in the country year over year. But because we're Catholic healthcare, we really believe and consider that, and the nurses believe that this is a sacred trust, that relationship between the patient and the nurse, as well as the family. The visual in the center, patient and family, being in the visual of the hands, our Franciscan sisters forwarded this ministry to us, put this ministry in the hands of those who are still part of this organization several years ago, and so it was important to incorporate that visual into the organization. The other part of this relates to what does it mean to be an SSM Health nurse? The I am statements that are across the lower part of the document really reflect what came from our nurses. I am professional, I am an advocate, I am a partner, I am accountable, and I am a leader. And from that, they've started working on professional and accountable. What does it mean within my clinical area to be a professional? What does it mean to be accountable? And this year they want to add partner. So the professional practice councils across the system are working on what does it mean to be a partner.
So when this was initially rolled out, Jeannie, what was the reaction from the nursing staff?
There was much excitement about this because they owned it, they created it, they understand it, and they're able to demonstrate every day, from day to day, for the patient and family, what each one of these characteristics of I am an SSM Health nurse means.
Maggie and Jeannie, thank you so much for sharing your stories today and what it truly means to be an SSM Health nurse. As you've heard, being a nurse at SSM Health is more than a job. It is part of a sacred trust. When you join our exceptional team of more than 30,000 employees, our sacred ministry is in your hands. At SSM Health, we believe each employee brings a special gift to our mission. What will yours be? We invite you to join our 144-year heritage of healing.
And if you feel that this organization will be the right fit for you, please come help us bring our professional practice model to life.